Since I last had an interview with you, which was at the Tory Party conference, I've smoked skunk.
I watched a bit of the programme.
Well,
and very
you will have
frightening
seen that it was a
too.
very horrible experience. And it is skunk, a form of marijuana, is nevertheless massively stronger than anything that you or I smoked when we were students. Now, the question I have is this. 25% of all diagnosed psychosis in London over the past 5 years, according to King's Hospital research, is skunk related. Is there not a danger that we are literally backing into the most appalling mental health crisis?
I think this is a real danger. I don't therefore reach the conclusion that somehow legalising drugs and regulating them is right. I think that would lead to more usage and more problems. I think the answer is to keep the laws we have, but to do better on education and also to do better on treatment.
You could argue that it would be much safer to give the whole thing to SmithKline Beecham and ask them to sort out a decent, safe marijuana. People are going to go on smoking it.
I think the problem with that is that I think you'd find drug use would go up, and I don't think you can guarantee that skunk use would go down. So I think you could end up making the problem worse. As I say, I think the answers are education at the front end and treatment at the back end, and particularly helping with mental health, which for the first time now we've got these waiting time limits for psychological therapies that can make such a big difference.
Prime Minister, thanks very much.